If you have POTS, you've probably been told to increase your salt intake or your water intake and make sure that you're staying super hydrated. This can be because of how blood volume contributes to the symptoms of POTS. Hi, I'm Chandler. I'm a naturopath and I have POTS and I help people with POTS to reduce their symptoms and improve their quality of life. POTS, it is a condition that affects the autonomic nervous system, so that is going to control our heart rate, blood pressure, and things like temperature regulation. As we stand up and our blood pools to the lower portion of our body, having enough fluid and having enough blood volume to assist this blood to get back to our head is essential. So when we have a low blood volume, it can be from a variety of things related to POTS. So it can be just from a poor intake of fluid and salt. It can be due to frequent urination or sweating, which is very common with dysautonomia. It can also just be from chronic stress and having our overactive nervous system. And it can also be from a reduction in muscle tone and overall deconditioning, which is very common with POTS. As you start to feel worse and worse, you lay down more, you're being less active, and we do lose that muscle tone. So all of these factors contribute to how much blood our body has to work with. The lower our blood volume is, the more that our heart has to pump to try and get this blood from our abdomen up to our heads. This is going to contribute to our things like fatigue and exhaustion, as the less blood in our heads, the less effectively our body and our brain is going to function. So we want to make sure that we're having at least 2 to 2.5 liters of water every single day. We want to make sure we're having plenty of salt in our diet or supplementing with electrolyte drinks. We don't focus on our blood volume and it is on the lower side. It is going to cause our body to naturally, in somebody without POTS, they would also have this response that your body tries to get your heart to beat faster in order to move that blood, because there's just not the amount that they need in these areas. But obviously this is already a symptom of POTS, so you're just adding in more stress to your system. Having enough blood volume is a key factor in the support of POTS.